Mercy Health is expanding cardiac care with new technology. The advanced imaging technology is designed to help physicians better understand coronary artery disease and determine the most appropriate treatment for each patient. Joining us now is Dr. Tariq Rizvi with Mercy Health. Thanks for being with us today.
Hey, thank you so much for having us over.
Can you tell us a little bit about how this device will work exactly?
So basically, we do cardiac CTs or CT scans to look at the blood vessels or the coronary vessels of the heart and see if they have any blockages or plaque buildup or not. And now what we're doing is we're able to go a step further and using artificial intelligence technology to look at these vessels and assess if there is any plaque buildup, which is not really calcified and not really visible on a regular CT. And then we can also see if any of these blockages are significant or are causing any physiological changes in impedance to the flow distal to those blockages.
So who really benefits from a device like this?
So anyone who is at risk of having coronary artery disease or who already has coronary artery disease, who are being screened for coronary artery disease, can benefit from having this testing. Out of all the modalities of testing that we have, from stress tests to nuclear imaging and PET scanning, this is just another tool in our arsenal.
What can coronary artery disease do to a person if they're not being treated for it?
So as you know, the coronary artery disease is one of the most common cause of mortality, one of the leading causes of death. And finding and discovering coronary artery disease early on can help prevent progression of disease, and we can modify it and we can help people live longer and better.
What are some of the symptoms of coronary artery disease that people need to be aware of and maybe watch out for?
So a lot of times the symptoms are not there early on in the disease, but as the disease progresses, people can have chest pain, pressure, heaviness, pain between the shoulders, shortness of breath with exertion. Women notoriously sometimes have atypical symptoms where they're not really having chest pain or jaw pain, and can feel even epigastric pain or heartburn as symptoms of angina, or are related to blockages of the blood vessels supplying to heart.
How can people help prevent heart problems for themselves?
Well, that's a very good question. Most importantly, taking care of yourself, making sure you're evaluated by your doctors, making sure your basic risk factors are looked at, checking your blood pressure, making your blood sugars are all right, screening for diabetes, getting your cholesterol levels checked. And if there are any symptoms remotely which are suspicious, getting yourself checked out and staying ahead of the curve.
All right, Dr. Tariq Rizvi with Mercy Health, thank you so much for being with us today.
Appreciate you. Thank you for your time.